So there we go. We're recording now. Welcome, everyone. I'm so excited to have you all here today. My name is Mary Ellen Gibson, and I am the project coordinator for the Positive Support Program for veterans with PTSD and who problematically use substances. The main focus of our project is to connect with service dog organizations across Canada and talk a little bit more about how we can better support veterans with PTSD and who problematically use substances in accessing service dogs and being supported by service dog organizations. I want to take a quick minute to recognize that the majority of our team lives and works in Treaty 6 territory in the homeland of Métis. So we recognize those relationships and reaffirm our relationships with one another. But we also want to acknowledge that there are many treaty territories, and unceded territories across Canada that many people are joining us from. So we want to recognize the land and how important that is to us. We're really excited today to have Dr. Darlene Chalmers, who will be facilitating today's conversation with Dr. Jordan Woodsworth, all about accessing veterinary care for your service dog and what that can look like and how to kind of mitigate some of the stresses around visiting the vet. I just want to take a quick second to introduce Dr. Darlene to everyone. I think most people might know her, but she is one of the lead researchers on our projects here in the One Health and Wellness office. She is a social worker and an associate professor at the University of Regina's social work department. And she does amazing work with us. She has an amazing background in equine assisted therapies. So if you ever want to talk horses and dogs and the wonderful relationships that we can have with them, she's a great source of knowledge in that area. And I am going to say once again, just thank you everyone for joining us. So excited to see you all today. I'm really excited for this presentation. And please, if you want to learn more about our work, visit servicedogresearch.ca and you can contact us that way. Dr. Chalmers, Darlene, I'm going to turn it over to you.
Thank you, Mary Ellen, and welcome everyone. We're just really pleased to be able to have this webinar offered here today with our presenter. And so I'm going to introduce Dr. Jordan Woodsworth, and Jordan, I'm going to refer to you as Jordan, if you're okay with that. Before I do that introduction, I just want to let people know what this next, I guess, about 50 minutes is going to look like. So Jordan is going to provide a presentation about 40 minutes long, give or take, and really what a veterinarian does working with a patient and client around animal health care, and just some preparation for you in connecting with your veterinarian with your dog, could be a cat too. And then we'll be sure to leave some time for any questions. And Mary Ellen had mentioned, you can certainly put those into the chat. I have some that I know that people are interested in, and that'll leave us right close to the end of the hour, and then we'll wrap up. So to get us moving along, as I'm going to bring in our great presenter. So Dr. Jordan Woodsworth is a third-generation settler of mixed British, Austrian, and Dutch ancestry, and she is living, working, and learning on Treaty 6 territory here in Saskatoon. So Jordan is a general veterinary practitioner, and she's part of the Wellness and Preventative Medicine team at the Western College of Veterinary Medicine's Veterinary Medical Center. And so if you're in around Saskatoon, you might know that place very fondly referred to as the Vet College. So, and there is the clinic there as well. She's a 2008 graduate from the WCVM, and then she joined the staff at the Veterinary Medical Center in 2012, and she started the wellness and service learning programs that are there. Jordan has a diverse background of professional interests. I certainly know about her community engagement, her interest in social accountability and social justice in the veterinary profession, and clinical communication is another important part of that, as well as really elevating the quality and perception of caring well for cats and dogs. Jordan does work in northern Saskatchewan. She's doing some really fascinating work in some of the northern communities, which is a really great area of true passion for her, and she really strives to use her role as a veterinary educator to provide opportunities for veterinary learners, practitioners to develop and practice culturally safe approaches to clinical practice. So she does have personal interests too outside of that, which are all around lake time, and many of us know what that's like and about. With her partner, husband, and their 2 children, she enjoys traveling, nature, and this is one of my favorites, eating and cooking amazing food. So Jordan, we're just so happy to have you here. And Jordan is also a member of our research team, bringing that veterinary perspective to all that we're doing. And so we just appreciate her taking the time to do this. And Jordan did a face-to-face presentation kind of like this in 2018. So with a group of veterans right on site at the vet college here. So we're pleased to have you back. So I'm going to hand it over to you, Jordan.
Thank you so much, Darlene. So hi, everyone. Thanks for coming today. I'm hoping that today's presentation will provide everybody with some valuable information that will help you feel equipped in navigating the sort of relationship that you might develop or, deepen with your veterinarian and your vet team with your service animals. So I really like talking about this stuff because to me, we don't talk enough with our clients about the importance of the relationship that we build and how that's such a crucial part of our work together, and that it is a two-sided relationship. So it's not us as the veterinary team dictating what happens with your dog. It's a reciprocal thing. And so we both learn from each other, and we find out what works best in that relationship between vet team and client and patient. So I wanted to start off by talking a little bit about the veterinarian's role. So what it is that we do as veterinarians and as veterinary teams. I'll keep referring to veterinary teams because I think it's crucial for us to understand that veterinarians aren't the whole picture. So we have an entire team working with us in the hospital, and we all are important aspects of what goes on, both in front and behind the scenes. So you've got veterinarians, but you've also got veterinary nurses or registered technologists. Much of the time, we've also got vet assistants, and then we've also got our house reception staff who do a lot of the client communication and a lot of that relationship building on an ongoing basis. So it's important to recognize the value and the importance of all members of the team. So like I mentioned before, as far as what we do as a team and as vet professionals, I really believe that relationship building is number one. So it's our job to build rapport and build trust with our clients, and to make the experience when you come into the vet hospital enjoyable and safe for both you as the client and your pet. So for me, this starts with getting to know each other. And so I tend to view all of my interactions with my clients as building a personal relationship, with boundaries, of course, but building a personal relationship so that my clients know some things about me and how I work as a clinician. And then I also know a lot of things about them and their pet. So this is part of what we do when we see you, especially for preventive healthcare visits. So this is when we collect a really detailed history. And this includes information about all aspects of your pet's life and your life with them. So it's their relationships with you and other members of the household. And it includes things like special roles that they might play in their families. And so in the context of this talk, we're speaking about, of course, service animals and the support that they provide to you. So as veterinary teams, we should be asking questions about those roles, but we don't always. Sometimes we get speeding through our histories and we don't always take the time to ask all of those questions. And so maybe we'll get that information from you by chance through the course of developing that relationship. But what I'm going to try and do for you today is help you build an understanding of the information that would be useful for us, so that you can then offer that information to your veterinary teams, even if they don't ask. Okay, and we'll talk a little bit about how to do that. So I think that getting all this information helps us to not only serve you during the vet visit, but also help you to best prepare yourselves and your pets before and sort of recover after the vet visit too. So with service animals, it's really important for us to ask about any particular requirements for the vet visit. So I've certainly worked with service animals like those that you might have in providing support for PTSD and other mental health challenges. I think I also do quite a bit of work with our Saskatoon Police Service dogs, and so those are service animals, working animals in a different capacity. And so we really need to understand as veterinarians what those animals do for you. So what is it that they're providing to you as far as support goes? Because that helps us to understand what it is that we need to do to best support them from a well care perspective, but also what we might do differently if something happens to them, they get injured or they get ill, how we might handle that differently from our average patient in the event that that occurs. So again, COVID has presented some challenges in all sorts of different areas, and the vet visit is no different. So right now in some places, clinics are in what we call curbside only mode. So they're not even allowing clients into the building. And not every clinic is doing that. Veterinary medical center, that's where we're at the moment. And so that might result in you as the client being separated from your animal during the vet visit. And so in the context of a human-animal relationship where that animal is providing significant support to you as an individual, that's something that it's useful for you to know in advance. And so if that's, we wouldn't want that to be a surprise for you. So I think it's an important question to ask if you're booking a vet visit. And then part of that conversation could be, what are the options, right? So if it's going to be really disruptive for your life to have your animal separated from you, and especially if it's a wellness visit, a preventive care visit, like an annual checkup for vaccines and things like that, there may not be a necessity to have that animal even come inside. I've done lots of things outside on the front step, weather permitting. And so that's a possibility. Those are things that you can ask about when you go to see your vet. Keeping in mind that in situations that are emergencies or where your animal might need hospitalization for whatever reason, or they might need testing indoors, you might still have to be separated from your pet. So ask questions about how long that might be. Getting as much detail as you can would be a great idea for you. And then also thinking about what you might do to support yourself during that time, whether that's bringing someone else with you to provide you some support and safety while your animal's gone. So yeah, I think that, those are really important things to think about at any time, but particularly during this pandemic situation that we're in, and thinking about the questions that you might ask when you call and book your animal in for a visit. So the other thing that I think is really important is putting some effort into searching for a veterinarian who is going to really work hard to make the visit minimally stressful for your pet. So service animals have a different awareness of things, and they have a different tolerance level for various inputs, right? So whether that's sound or touch or any of those things, than maybe the average pet might. That doesn't mean that they won't get stressed in a new situation in the vet clinic. So it's worthwhile asking about those things when you, especially if you're developing a relationship with a new clinic that you've not seen before, but even if this is a clinic that you've had a relationship with for some time, asking them about what they do to ensure that their team is using techniques that are going to minimize stress for your animal. So some of the catchphrases that you might hear or see on stickers on the door might be fear-free or low stress or force-free. And for me, these are fundamentally important strategies that we can use to not only build our relationship and our rapport with our clients, because then you see us being gentle and respectful with your animal, but also that relationship pet. For me as a vet, I want my patients to at least a little bit enjoy coming to see me. I want them to think that they're going to have some fun when they come through our door. And I want them to not be stressed the moment they set foot through the clinic doors. We're not always successful because it depends on what we're doing with that animal. I think it's something that we all should be working towards. And there are lots of different ways that we can do that while also getting done the things we need to do. Worthwhile asking about that from your veterinary team before you go and visit. So I think it's important for everyone to know the types of information that are useful to us to know about you and your pet before you come in. So when I talk about history taking, really what this means is I'm trying to gather as much information as I can about your pet and about their role in your household, so that I can best decide what I should recommend for them as far as preventive care goes. So this is how I teach my students to take histories for healthy patients. So again, that's for patients who are coming through the door for their annual checkups, who don't really have any big presenting medical complaints, but just trying to understand their whole health and their whole, their day-to-day life, basically. So again, anytime an animal might be coming into the clinic with a primary health concern, the history might change in structure. But this information is always important for us to have, and especially if you've never been to that clinic before. So one of the things that I would recommend is thinking about all of these different ideas, and I'll tell you sort of the questions that we would ask for each of these, and coming up with a document that illustrates the answers to these questions for your pet. And then that's something that you can have in a file that you take with you every time you take your dog or your cat to the veterinarian, because then if they don't ask these questions, you can still give them that information. But on the flip side, if they're asking you the questions, you've got prepared answers that you've thought about in advance, which can be helpful to make it easier to think up the answers, right? And help you to remember some of that information. So for example, nutrition, a lot of times I find when people come through the doors with their dog, if they're not prepared to answer all of the detailed questions that we ask about their dog's diet, often we don't get the information that we need. So these are some important things to have your answers to in advance, whether that's written down or just in your mind. But I would suggest writing them down and updating them at least once or twice a year. Then you can hand that information to the veterinarian, even going in for an emergency, let's say. So in this document that I'm talking about, you could also include other things that you need the vet team to know. So for example, again, being really clear about your dog's role as a service animal and what that entails as far as their relationship with you, and then how they function as a tool for your well-being. Also, if there are things for you that might be activating during the vet visit. So for example, some of my clients are really scared. It's important for me to know about that before I try and give their dog an injection in front of them, because then what we can do is we can tailor our visit, particularly if you're going to be present for any of it, in a way that's going to be safe for you as well. So the last thing is, if you are someone who has any physical limitations, it's good for us to know that too, because then we don't give you any treatment plans for your dog that would be either difficult or in some cases impossible for you to physically manage, especially if you live alone and don't have help on a daily basis. So coming back to this history. So typically when I'm collecting a history from one of my clients, I start by asking them to tell me about an average day in the life for their pet. So this includes things like where they spend most of their time, what they do for exercise, what they eat, and anything else they feel is important. So for me, what that does is that allows me to then be quiet and allow the client to tell me the story about their animal. Because what I find is I often will get have a lot of the information that I've got listed here in one go when I ask the client that type of question. So always feel free to give all of that information. If it sounds like they're looking for it, give as much of this information as you feel comfortable giving right off the hop. When I've still got gaps, I'll go through each of these items one by one. So as far as lifestyle goes, usually the question I'll ask is, where does your pet spend most of their time? And when that changes, where else do they go? So what I'm looking for here is, are they mainly indoors? Are they mainly outdoors? Do they come in contact with other dogs, say at dog parks? Do they have a special sport that they do? So some dogs do things like flyball, for example, or agility. Do they, in your case, do they go most places with you? Are they out in public a lot? So they have the potential to come in contact with lots of different people, lots of different animals. And again, including their special roles. So what they do to support you as well in their role as a service dog. As far as contact goes, what I'm really interested in there is finding out not only the other animals that they might be in contact with, including wildlife, including livestock, including other cats and dogs, but also people. And so when I'm thinking about the people that are in contact with my patients, I'm always wanting to know about folks who may not have fully functioning immune systems. And so this is important because there are certain parasites that cats can pick up that transmitted to people and make people sick. And usually that only happens in folks who don't have those fully functioning immune systems. So this would mostly be either kids under the age of 5, partially because their immune systems aren't mature yet, and partially because they put things in their mouths more than older kids do. Individuals over the age of 75 or 80. People with chronic illness, so whether that's things like HIV or cancer or organ transplant, things like that, or if there are pregnant women in the household. I also include in there people with intellectual disabilities. So I have a younger sister with intellectual disabilities, and she, like many 5-year-olds, puts everything in her mouth. And so that's a question that I add on to there. And again, that helps us to figure out what it is that we need to do for that dog as far as preventive care goes in order to decrease their risk to their family and to the people that they're in contact with regularly. So I assess not only their potential to pick up parasites, so their potential to pass those on. And again, it's not actually only parasites I'm worried about. So when we get over to nutrition, I'll talk a bit more about this, but in dogs who might eat, say, raw food, that helps me to determine how much I'm going to counsel the client on the risk associated with that if that dog is also in contact with people who don't have fully functioning immune systems, because again, the risk of passing on bacterial illnesses and also in some cases parasitic illnesses, that will change depending on who they're in contact with. Okay. So for exercise, again, usually what I'll do is I'll say, what is it that you do to encourage your animal to get exercise on a daily basis, or what's their normal exercise routine look like? Some people think it's funny when we ask about exercise routine, but really what we're looking for is what type of exercise does your animal get? Are they going for runs every day? Do they walk every day? For cats, are they playing with a laser pointer every day so they're getting some movement and things like that? And it helps us to determine, again, maybe how high a risk they are for things like joint illnesses and other things like that, depending also on the life stage of the animal. So if they're elderly or if they're really young, that again will change the risk associated with the type of exercise that they do. So for travel, again, we'll ask, where has your pet gone in the last year outside of Saskatchewan, or where do you plan on taking your pet outside of the province in the next year? This helps us to assess for certain diseases, whether it's parasites or other things that your pet could be at risk for outside of Saskatchewan that we don't have here. And again, that helps us to determine, say, what kind of deworming we're going to recommend, if there are any special vaccines we're going to recommend, things like tick prevention. All of those things can be helpful for us to know what we're going to do with them based on their travel history and travel plans. Medical history, again, if we've not seen your animal before or you've been to other clinics, it's important for us to know about anything that's happened since the last time we saw you, but also if you have been experiencing anything with your animal since they were last at the vet, but that you haven't taken them to a veterinarian for, we want to know about that too. So say your dog has been a little bit off their food for the last week, eating less than normal, or they've had a little limp, or you've noticed a bump, right? All of those things are relevant to tell us when we ask about medical history. Surgical history, same thing. Here, I often want to know, is your pet spayed or neutered? When did that happen? How did the surgery go? Were there any complications? If you owned them already at that time. And then as well, knowing if there's been anything since we last saw you again at any other hospital, because that allows us to then say, oh, we're your main veterinarian, so maybe we better get a hold of those records so that we have them in your animal's file. For dental care, I'm always looking to find out not only whether your animal has had any dental care at a veterinarian before, but also what you do to keep their mouth clean and healthy at home. So this might look like brushing, it might look like special chews, it might look like putting something in their mouth to clean their teeth. We have some gels and things like that that can help to keep mouths healthy. Some people use water additives. So all of those things are relevant for us to know about, as well as if they've seen a veterinarian for dental care in the past. So you might know that most of the time when we're doing dentals on dogs, we have to put them under anesthetic because they don't do a very good job of staying still for us when we want to clean their teeth. And so it's good for us to know if they've had that before and it's not in our records, so that we can ask about what was done and any complications again. As far as vaccination and deworming history, this is where if we've not seen you before, but you've been to other veterinarians, say you're coming to a new vet or you've just acquired your animal and you've got some vaccine history from before you got them, bringing that history with you is really important because we want to see what they were given, when they were given it, and then that helps us to determine what they're going to be due for next and when that needs to happen. So that in combination with all the other information that we've collected already in terms of their lifestyle and who they're in contact with and all of that will help us to determine what we need to do for them on that day. Deworming history is important too. So here I'm lumping in anything that targets intestinal parasites, external parasites like fleas and ticks, and all of that stuff kind of comes under the deworming history for me. So if they've been given pills or a liquid by a veterinarian, or something to go on the back of their neck, a topical product. If you use a flea collar, any of those things are good for us to know. And we're thinking not only about stuff that you get from the veterinarian, but also things that you might get over the counter at, say, PetSmart or any of the other pet stores. So telling us about all of that is really valuable. And as a part of that, we want to know whether there have been any issues with those things. So any previous vaccine reactions or any problems with the parasite treatments that they may have had in the past. The one thing I'll just mention about parasite products, especially because now is tick season and we're starting to see a lot more of those little critters. My daughter had one on her leg yesterday. And so there are tick products out there that are safe for dogs, but very dangerous for cats. So in particular, it's topical products that many of them are over the counter that you can get either at the pet store or over the counter at your veterinarian. And so if you are getting a tick product for your dog and they haven't asked about other animals in the house, but you do have a cat that comes in close contact with your dog, it's worthwhile asking if that product will be safe for your cat. Because particularly in situations where cats and dogs really like each other and the cat maybe grooms the dog, putting that topical product on the dog could be very, very risky for the kitty. So usually in that case, we would recommend a different product, or we might recommend, if it's not possible to use a different product, to keep the two of them separated for at least 24 hours after that product is applied so that there's no risk to the cat. Okay. The other piece of it is behavior and training. So I think in your case, because these are service animals, their behavior and the things that are desirable are going to be different from the things that we might wish to see in the average pet, but also their training is going to be different. So it's worthwhile telling us about things, even if we don't ask. Again, tell us what their normal behavior is like, tell us what it is that they've been trained to do, and any issues that you might be having with either one of those things. So, for instance, if your dog helps you to navigate public spaces, let's say, right? And you take them on the bus and all of a sudden they've developed a bit of a fear of that hissing noise that buses make when they lower to the ground. That's something that's really worthwhile talking to your veterinarian about, because those are things that we can help with. So just remembering that any of these things are things that we can at least give you tips on. And if we don't have the answers, we can figure out who can help you in particular. Okay, because it's so important for your animal to be functioning well, not only from a physical health perspective, but also from an emotional and mental health perspective, so that they can be the best support to you that they can. As far as bathroom habits go, what I'm really looking for here is your dog peeing and pooping normally, regularly? Have they had any issues either peeing more or less than normal, or having, softer or harder stools than normal? Are they having any accidents in the house, anything out of the ordinary? Those are the things that we want to know about. And so most people will also tell me how frequently their dog goes to the bathroom, if they're well house trained, and anything else that they may have noticed that's a problem for them. As far as nutrition goes, so again, this is a really important part of our history. Over the last several years, we've had a lot of talk on the veterinary side of things about how important nutrition is to the whole health and to the sort of length for our patients. And we know this intuitively for both animals and humans, but it's just being given more attention these days. So we really want to know as many details as you can give us about what it is that your pet eats. So not only the type of food, whether it's hard or soft, kibble or a canned food or both. We also want to know brand and type. We also want to know how much, whether they get treats, what their appetite is like, if they have any allergies to foods that you know of or you suspect. And I also always ask about access to water and their thirst, right? So if their thirst has been steady, they drink a certain amount of water a day, that's great. If you've noticed that they're drinking less or more than normal, we also want to know about that too, okay? Because some of those things can be signs of underlying illness for sure. And then at the last part of the history, I always ask about any other concerns that our clients might have and anything that hasn't come up already. So any changes in their mobility, so if they're limping or having trouble jumping up on furniture, if they're allowed to do that, those types of things. If there are any new lumps or bumps that you've noticed, any shaking of the head or scooting the bum along the ground, scratching anywhere, any of those things. If you notice any changes to their vision or hearing that you can appreciate, those are all important things for us to know as well. So that's kind of it for the history. It's a lot of information, and so you can see why it might be important to have some of these answers kind of tucked in your back pocket in a document or something like that, so that you can easily answer them when they come up, or in the event of an emergency, you can hand that information to the veterinarian or the vet team so that they have it and they can determine what needs to happen for your critter. So the other thing I'll mention is sometimes, depending on the life stage of the animal, we might recommend some different things as well, over and above any vaccines or any parasite products that we might recommend. So this might involve blood taking. So in young cats, we'll often recommend testing for feline leukemia and feline immunodeficiency virus, which are two viruses that they can get from being around other cats, whether it's because they go outside or whether it's because they came from a multi-cat environment, a shelter or something like that. In dogs, depending on, again, their lifestyle, where they've traveled, and how old they are, we might recommend blood work for some different reasons as well. So just knowing about that and coming prepared for that is good. When you book your vet visit, asking if they want a poop sample or a urine sample to be brought in at the time of the visit is also worthwhile, because in some cases it might be easier for you to collect that at home than for the vet team to be able to collect it when your animal's in the hospital, okay? And if there's anything that you know is really bothersome for your animal, so for example, if they really hate their hind end being touched, then it's good for us to know about that beforehand. As well, if for whatever reason they get really nervous when they're separated from you, but we know that that might have to happen during the vet visit, we can help with that in advance by potentially giving them some medication so that they can feel a little bit less anxious before they come through the door. And that not only helps them to feel more comfortable in the hospital, but it also helps us to be able to do the things that we need to do without elevating their stress during the visit. As I mentioned, we really want that visit to be at least a little bit pleasant for our patients. And so if we're not pushing them over and above their threshold of tolerance, then there's going to be a better outcome there. Okay, so I'm going to move on to physical exam. So I'm just going to try, I don't know if it's going to work. I want to try and change my background so you can see me a little bit better, but I'm having difficulty with that. That's not going to let me do it, so that's okay. I'll just do my best. I'm just going to move a table up here so everyone can see me a little better. And so this is my dog, Polly, and she's about 3 years old, and she's a pretty tolerant girl. So she's pretty excited about doing this because I've got peanut butter for her. So it might give her a bit of a tummy ache, but we're going to do that anyways. And this is part of what I'm talking about when it comes to making the vet visit a positive experience for our patients, is giving them something that's interesting and fun. And for dogs, often that takes the shape of food. That's one way that we can make the vet visit more pleasant for them. So for me, when I'm starting a physical exam, when I'm taking my history, if the animal's in the room, I'm just looking at them, finding out how their coat looks, finding out what their posture's like, seeing if I can tell whether they're stressed, if they're limping, any of those things, okay? And then for me, I don't always do a nose to tail physical exam. I sometimes start around the neck and the shoulders, and then go to the head last, because some dogs and cats are pretty head shy, and they'll end up being more nervous if I start by looking them in the eyes. So what I'm doing right now is I'm just feeling Polly's lymph nodes. And so I always want to make sure there are 3 sets of lymph nodes that we can feel. And lymph nodes, of course, are part of the immune system. They help tell us if there's any infection or inflammation in a certain area of the body. And so there are 3 sets that we can feel easily. There are these ones right by the jaw, right in front of the shoulders, and then there's a set right here at the back of the knee. So we always feel for all 3 of those when we're doing our physical exam. And that helps us to, again, pay attention to any area that might be having trouble. So I also will feel right around her windpipe, her trachea, and I give it a little bit of a squeeze. And we do that so that we can see if they're having any inflammation in their windpipe or their trachea. And so for me, then I'll go next to flexing and extending her front legs and the other front leg. And that helps me to determine if there's any joint or muscle pain there. And then I kind of feel along her body, and I do this all in a way that kind of feels like just a really good rub. And then I go to her belly. So this is going to allow me to feel some of the organs in her abdomen. So I can usually in a dog feel their bladder, if there's anything in it. I can feel their intestines. I can feel the muscles, their abdominal muscles. I can usually feel in dogs at least the back part of one kidney, their stomach if it's got anything in it, and every once in a while I'll be able to feel their spleen too. So I'm just kind of squeezing in there. Some dogs like it more than others. Polly, even though she's really comfortable with me, she's not a huge fan of having her belly poked. So she kind of tenses her muscles a little bit while I'm doing that. But I can feel most of the things I want to. I'm going to give her a little bit more peanut butter since we're out again. She keeps licking it off the table really quickly. And so then for me, I look under the tail. And again, this is why it's important for us to know if your dog really doesn't like that. I move her tail from side to side and up and down and just make sure it feels okay. I feel on either side of her bum. Dogs have these little things called anal sacs in there that are kind of like skunk scent glands. And they sometimes will get full and really bother the dog. So I take a feel of those. And now I'm feeling her knees. So dogs' kneecaps, especially in these little dogs, they'll sometimes have loose kneecaps, which can cause them grief. And so I'll feel for any problems with their kneecaps there. And Polly's are actually nice and healthy and tight, which is great. And then I'll do the same thing I did with the front legs, but on the back legs. So I'm going to flex and extend. So that's knee extending her hip and then flexing her hip and her knee. And then I do the same down her little ankle and her toes. And I flex and extend everything because that helps me to see, is she having any pain anywhere? And if I do get a pain response, that tells me, oh, I got to look in more detail at all of those different areas. And then the last few things that I'll do is there, you can lick that. The last few things that I'll do is I will go up her body. I'm sorry, I'm going to tilt this up a little bit more. Go up her body, feeling on either side of her spine and just putting a little bit of pressure there so that I can see if she's got any pain in her back. And then I flex and extend her neck. So I go all the way up, all the way down to the side and to the other side. Again, that helps me see if she's got any pain in her neck. I'll look inside her ears, and sometimes we'll do a full ear exam with one of those lights with a cone on the end. We call it an otoscope. So sometimes we'll do that as well. And then I take a look at her eyes. And for me, I will always, hold on, don't fall off the table, silly dog. I will always look just at how clear her eyes are. But dogs also have this funny third eyelid. So I'll push eyelid up here, and that pink third eyelid will come up. And so sometimes dogs will have problems with those third eyelids. So it's important for us to look at those. I look at her little nose, and then I do a mouth exam. So I look at her teeth, and I'll usually open their mouth all the way to look inside there. And then I look on the teeth at the other side, look at her gums. That helps me to figure out if she's well hydrated and if her blood circulation is good. And then that's kind of almost at the end of my hands-on physical exam. I also will take a listen to her heart. So I'll use my stethoscope and I'll listen to her heart and I'll listen to her lungs. And so I usually just do that while she's nicely distracted. So I'll listen here to her heart and on the other side. and then all over her lung field. So that's kind of all over this area here, all the way to the back of her ribs. And that will help me decide if, she's got anything going on wrong with her heart, whether that's a problem with blood flow or a problem with the rhythm, and tell us if we need to do any further investigation. And then that's kind of it for my physical exam. So sometimes we'll also take a temperature. I don't have a thermometer with me at home today, but we'll either do that just under the armpit, which is often how I do it. Some veterinarians have an ear thermometer, or sometimes we put a thermometer in the rectum, so an anal temperature. And most dogs, again, if they're well distracted, they tolerate that quite well. The odd dog really, really hates it. So again, that's why oftentimes I will take a temperature in the armpit and just go from there. So that's it for our physical exam. The one thing that I'll mention while I put myself back together here is that there are some things that you can do at home to get your dog comfortable with the things that are going to happen when they come in for a physical exam at the veterinarian. So I showed you that I go inside the mouth and I take a look at all the teeth. I look inside the ears and do all of that. Some dogs are really uncomfortable with having their head manhandled in that way if they're not accustomed to it. So some of the things that you can do at home is you can get them used to those things. So give them some positive reinforcement, whether that's treats or pets or any of those things, playing with their toy. When they allow you to look inside their mouth, lift up their lip and look at their teeth, to kind of put your finger in their ears and play around in there. All of those things will really help us, because then it desensitizes your dog to having those things done. Make sure that you put your hands all over your animal, in a good way when they're happy and when they're relaxed, right? Touch their feet, move their legs around, touch their belly, put a little bit of pressure there, do all of those things, because again, that will just make it easier on them and easier on us when they come through the door. Okay. So in terms of why it's so important for us to focus on preventive health care and on veterinary care in general, is if we focus on preventive care and having that relationship with your veterinarian that's based in trust and based in the information that we have about you and your pet, there's less need for emergency or intervention throughout the animal's life. And we can also better, when we do need to have intervention, so have emergency or urgent care, we're better able to do that because we know more about you and your pet. And we have that previously established trust, so you'll feel better about it as well. So again, preventive care is a focus on seeking and maintaining the whole health of your pet. And that involves physical health, it involves emotional health, and it involves the human-animal bond. Because the human-animal bond isn't only important for you, it's also important for your dog. And so when we can assess both sides of that relationship and make sure that everybody is getting the most out of it, that's when we can have the best success in terms of health and well-being for you and for your animal as well. So again, preventive care, the why of it is because relationship and trust building are so important. We have this foundational information to inform future care. It helps us to prevent disease and illness, which helps us to prolong the life of that animal and therefore prolong the human-animal bond. So particularly in the context of a service animal, that's so important because you want that animal to be with you for as long as they can be. It helps us to identify problems early. So I talked before about starting to do some blood work in animals when they get a little bit older, especially. And that can help us to say, ooh, their kidneys are starting to not function as normally as they should. So let's start them on some sort of a treatment plan so that we can prolong the health of their kidneys and therefore prolong their life. Okay. Again, I mentioned that we can help to establish a positive experience for your pet and for you. And it allows us as a team to learn how to best serve you as an individual and your pet. So gone are the days of sort of blanket approaches to veterinary care. I think we're really at the point where individualized care is a really recognized important part of what we do. And we should be able to tailor our approaches to the individual animal and to the individual owner and family. If we're not doing that, we're missing the mark, in my opinion. So you can ask for that kind of care, right? And you should be seeking out that kind of care because, again, your animal is an individual, you are an individual, and your bond with your critter is unique. So making sure that you're getting that type of attention from your veterinary team is really crucial, okay? So that's all I've got in terms of content. And I know that we're getting towards the end of our time here. So I'll finish up so that I can answer any questions for you folks. And maybe, Darlene, is it helpful if I stop sharing and then we can...
Sure. Yeah.
Okay, I'll do that.
Thank you. I did see. Thank you so much, Jordan. That was really helpful in such a short period of time, very thorough as well. And it's covered, I think some of the questions that come to mind, and certainly some that I had around the, considerations that we as clients in bringing in our animals who are patients of a veterinarian, what we can do to prepare. A really interesting comment here is, just a person here in the chat just mentioned, Kathy put in that she's been to a new vet and didn't know much, the vet didn't know much about a service dog, and she wasn't able to ask any questions about training problems, and they didn't understand about being, the whole nature of separating the dog from their person, right? And I don't know, Jordan, if you just have any reflections on that or comments that you want to add.
Yeah, I'm sorry, Kathy, that sounds like it was a bit of a frustrating experience. So certainly, again, like I mentioned, I think that I always want clients to feel empowered to ask for things from the vet team. I think that very often in a healthcare provider, healthcare recipient relationship, there tends to be a power dynamic. And so people can sometimes feel uncomfortable asking for things. But I think much of the time for vet teams, they don't know what they don't know for this type of animal. So again, oftentimes we get so used to treating and managing the health of the average house pet that we don't think about these different roles that animals can play in people's lives. And so, now I think you hopefully have some information to help you screen for that when you phone a veterinarian. Even asking things like, what is your team's experience with service animals, right? So this is a service dog for me, and I'd like to know what your team's experience is with that. And are you willing to learn with me about how to best serve me and my animal, knowing that our relationship is unique and different from your average patient? Because I think that you're paying for the service, so you get to decide who you pay. Hopefully, in most cases, right? Unless you're in a community where there's limited choices as far as veterinarians go. But for me, I would say in that scenario, it would be totally okay to phone that vet office later and say, this was something that felt frustrating for me during the vet visit, and I wonder if I could have a conversation with the veterinarian or maybe the technician about how we could improve that for my next visit, right? Because then that gives them the opportunity to do better. If they're not able or willing, then hopefully that means you can find a different veterinarian. But most of the time, I think my colleagues are usually quite interested in serving their clients to the best of their ability. And so if that means that they have to learn some things, then that's okay too.
Thank you. Thanks, Jordan. Just another, there are some number of questions coming in, and I just, one of the questions is an irregular heartbeat for a puppy okay?
It depends. It's one of those things that there are lots of different reasons why a heartbeat might be irregular. So in some dogs, their heartbeat is just irregular because when they breathe, they get a little bit of a slow heartbeat. And that's it's okay, it's common. But there are some irregular heartbeats that are dangerous. And so are situations where they could be, as you mentioned, Irene, that you could have problems with that animal going under anesthesia, for example. And so it might be worthwhile, if that's the case for you, to ask if they can do any further testing on that dog to find out what exactly the underlying problem is, because just listening to the heart doesn't actually give us the full information. Sometimes we have to do further testing to see what the actual heart rhythm is doing, and if there's also any structural issues with the heart. So that would probably be the next place I would go in terms of what to ask. And yeah, in terms of not neutering, again, it depends on where you're located. If you are in a place where there is a referral hospital, so a specialty hospital, those are places where usually there are people who are specialized in anesthesia, and that would be the best case scenario in terms of being able to put that dog under anesthetic to have its surgery. So because those people are trained to just do anesthesia and they make it as safe as possible. So
yeah, Jordan, thank you, Jordan. What are some of the ways that dog owners can troubleshoot some of the medical health issues at home. So for example, you have a dog with itchy ears. Are there things that, you know, you can just be sort of preventative in addressing those at home without needing a medical checkup?
Yeah, that's a great question. So one of the things to remember is that we can, as veterinarians, do what's called telehealth. And so telehealth means that we can give certain types of advice over the phone, even without having seen your animal in the past. And again, this changes from province to province and region to region, just depending on the bylaws for the veterinarians in that area. But in Saskatchewan in particular, if you phoned me and said, my dog's got itchy ears, they're just a little bit red, what can I do at home? I would say, well, you could clean them, right? You could use a veterinary ear cleanser. And if you got in there a couple of times a week and you cleaned their ears and it made a difference, great. If you tried that and it either made it worse or it didn't change it at all, then I'd say it's time to come in and see us, because ears can be a bit of a tricky monster. You can have infections with yeast, you can have infections with bacteria, and those require different treatments from one another. So unfortunately, it's not a super easy thing to always manage from home. But if cleaning does the trick, and especially in dogs who swim, for example, who have floppy ears, I think it's one of those things that they're more at risk for developing some of those pretty simple, straightforward ear infections. And so sometimes what we can do in those dogs is, if they're predisposed to those things, we can send you home with a medication that you can use as needed, and that can help to manage it over the long term. So you can always ask your vet about that as well.
Great, thank you. We're getting lots of really great questions here. There's a question around supplementing a dog's diet. So whether that's with minerals, vitamins, probiotics, some people are using glucosamine. What's your perspective on that?
Yeah, I think supplements are great for the most part. So to me, I think that we use them for a reason, and sometimes it's not worthwhile using it. Sometimes it's more of a waste of your money than anything. So if you're feeding your dog a good quality dog food, they should be getting most things through their food. But that said, if your dog has particular needs, so let's say if, despite the fact that they're on a decent dog food, they have a rough and dry hair coat, in that case, some omega-3s or fish oils might be helpful. Similarly, if they have arthritis, fish oils are a great natural anti-inflammatory, and so that's a fabulous supplement. Glucosamine and chondroitin can also be useful there. As far as things like probiotics, I love probiotics. I think that there isn't a ton of excellent research on probiotics in dogs, but there is some. And so particularly in dogs that are predisposed to diarrhea, especially if that diarrhea is related to stress, probiotics in many cases will do the trick and just keep them on a level playing field so that they don't end up with those bouts of diarrhea as frequently or as severely. So most of the time those things they're not going to hurt, and much of the time they will help. It just depends on your dog's individual situation. And again, I would always have those conversations with your veterinarian, but that can be a simple phone conversation too. So.
Right. Thanks, Jordan. Here's another question. You know, in your experience with service dogs and police dogs, have you noticed or observed that the dogs are maybe more reluctant to be separated from their handler? And you know, you mentioned this during COVID with those visits, and often the animal is separated due to the restrictions related to COVID safety practices. So, any comments on that?
So I think in the context of police dogs, for example, so those dogs are incredibly bonded to their handlers, and they kind of only listen to their handlers, to be honest with you. So it is difficult to separate them, and much of the time we don't. Partially also because those dogs have the job of biting people. So for our safety as well, it's easiest to keep them with their handler. However, in the context of service dogs like we're talking about today, yeah, I think a lot of times, because that bond is so strong between human and animal in those scenarios, it can be really hard on both parties. So both the human and on the animal when they get separated. And so that's why if the separation is going to be necessary, we can usually help with some better techniques, but also with some consideration of what are our other options. Can we do some more things outside with that critter today? But also, are there medications that we need to give to that dog so that it makes that visit easier? For me, I don't ever hesitate to use medications like that to make the vet visit better, because again, what that just does is it takes their threshold for stress from here up to here, so we can do more with them before they really get overtly stressed than if we didn't have that medication on board. So yeah, I do think that, and again, COVID has really spread this phenomenon of separation anxiety in animals around a lot more, because so many people have been working from home. So even the average house pet who previously might have been at home alone for 6-7 hours during the day, even more in some cases, now they've got humans home all the time, so they don't want to be alone, and it's a lot more difficult for them to be separated from their people. So it's something we're seeing more and more for sure.
Thank you. Thanks. Just a couple more here, and we really appreciate the questions. So someone's asking if there might be a reason why their 7-month-old puppy is maybe having a hard time with house training.
Ooh, great question. So it kind of depends, and always, this is why when we talk about the bathroom habits part of the history, when we have a puppy, I ask a lot of questions about house training, because it is really important for us to know how that's going and what the people in the picture are doing, because much of the time there's a disconnect between what the dog understands and what we understand as far as what they should be doing. So usually my recommendations, especially if a dog has, like an older puppy, has previously had pretty good house training and then all of a sudden they've relapsed back into peeing and or pooping inside, I tell people to go back to the basics. So from my perspective, that looks like when you let your animal outside to go to the bathroom, go with them. And as soon as they pee or poop in the place that you want them to go, lots of praise, give them a treat, do all of that, because what that does is it reinforces that idea of, this is where I'm supposed to do this action, right? This is where I'm supposed to pee and poop. And then when they do have an accident, my recommendation always is ignore it, right? So just go about your business and move on, because what can happen sometimes is it's very frustrating to house train puppies in some cases, and I'm sure the person who asked this question can certainly relate, because I bet they're frustrated right now. And so we sometimes get angry, right? We'll sometimes shout or do whatever, right? A lot of times we'll yell no, even if we don't intend to. Sometimes that still happens. And what that can sometimes do for our dogs is it can make them really scared, and it can make them feel like, oh, to hide this. And so sometimes they get sneaky and they'll go and they'll poop behind the couch, or they'll pee in the laundry room, or whatever it is, so that you don't see them doing it and they think they're hiding it from you. And then they don't necessarily want to go in the right place at the right time either. So it can be all about making that experience more positive for them again, and really reinforcing, like, hey, this is what I want you to do and this is where I want you to do it, but not paying attention to when they do the wrong thing in the wrong place. And that hopefully will flip that on its head a little bit for you and make it easier. In some cases, it's important to recognize that there can be underlying medical concerns too. So sometimes it's behavioral, but sometimes there are underlying medical things. And so, making sure that if you try those training tricks and they don't work out for you, contact your vet, because they may need to look further into that for sure.
Thanks, Jordan. I think we've got time. We've got a couple minutes left, maybe one more question and we'll wrap up. And for anyone whose questions that I'm scrolling through that I may have missed, Jordan, are you okay if people want to send those questions in to us and we can forward them to you? And
absolutely, yep,
okay,
for sure.
So here's the last question. What are your thoughts on giving dogs CBD oil to help with pain and just overall health?
Yeah, it's such a great question. I think, again, we're seeing lots more of that on the human side of things. And I've used CBD oil myself and find that it makes a difference in some cases. So I think, right now there's research happening actually at the vet college looking into CBD oil, and basically its safety profile first for cats and dogs. And so far things are looking good. So far it looks like the safety profile is quite good. And so it's not causing any risk. As far as benefit, we don't know a lot yet as far as how efficacious it is, but thus far it looks like it's not going to do any harm. If you are using it in your animal and you're using it at a dose that you've consulted with your veterinarian and it's going to be safe, then go for it. I don't think it's, generally speaking, going to cause any issues. Again, if you notice any problems, especially if it shows up like they're really sleepy, more sleepy than you would expect, or they're vomiting or having diarrhea after you give them the oils, then I would discontinue it and again talk to your veterinarian. But right now, we don't have as much information as we'd like to have to be able to hang our hats on. Yes, it's going to be a benefit, but it looks so far as though it's not going to be a risk. So I can tell you that anyway.
Thank you. All right, thank you. Well, we're at 2 o'clock and we've come right to a screeching halt here. Jordan and Polly Pocket for doing the demonstration with you and doing that very well and enjoying her peanut butter. We just want to let you know that we're absolutely grateful for you taking the time to do this presentation. It is incredibly helpful, as I said, really thorough and really clear. And what's apparent to me, and I hope for others listening and watching this webinar, is that your passion for that human-animal bond and your understanding of that connection just comes through so strongly in what you do in your work. So we really appreciate that, because that bond is certainly what we're looking at in our research and connection and what this is all about. So for people who had questions, if you want to forward those, if you've been in contact with Mary Ellen, you can forward them by email to Mary Ellen, maryellen.gibson@usas.ca, and then Mary Ellen can get those to Jordan and help make that connection. So thank you for everyone attending today, and thanks again, Jordan, much appreciated.
Thank you very much.
Wonderful. Thank you both again. As we say goodbye to everyone, I also just want to remind you that next month, June 17th, we are actually going to be hosting a stress and dog session. So that's going to even build off of Jordan's talk today, so that we can learn more about recognizing stress in our dogs and what we can do to limit that or address it if it gets to be too much. So be sure to be watching your emails and the newsletter for that. I think that's going to be a great session to jump off of. Thank you so much, Jordan and Darlene. Everyone have a wonderful day and the rest of your week. Thanks so much.